Velkommen til Økonominyhetene her hos oss i Finansavisen, direkte fra Smestadammen i Oslo. Det blitt onsdag 2. oktober. Mitt navn Stein Ove Haugen. Thor Medical meldte for en uke siden at pilotfabrikken som skal produsere alfa-emittere til bruk i kreftbehandling var ferdig. Det satte fyr på aksjen, som på det meste tirsdag var opp 70% de siste 4 dagene. Administrerende direktør Jasper Kurth med oss om litt. Men vi begynner med det som har vært med på å prege utviklingen på Oslo Børs i dag. Der 14 av de 20 mest omsatte aksjene stiger. Og blant de som mest omsatt og stiger, så har vi oljeaksjene som opp 3-4%, Equinor opp 3,8%, Aker BP3 opp 3,8%, Vår Energi opp 4%. Vi kan også ta med Frontline som stiger over 4% av aksjene som faller, så Nordic Semiconductor ned nye 0,4% til 99 kroner og 20, til under 90, til 99 kroner i øyeblikket. I tillegg så Cadeler ned 1,9%, Norwegian Air Shuttle faller 3,6%, og det kanskje ikke så overraskende når oljeprisen stiger såpass kraftig som den gjør. Oljeprisen den har jo vært over, har vært over $76 på fatet på det meste, og spotprisen har også stanget over $76, og ligger nå på, den har falt litt tilbake, og nå på $75,42, opp 1,5% siden i går kveld. Hovedindeksen på Oslo Børs opp 1% til 1439,22 i øyeblikket, og som sagt så altså 14 av de 20 mest omsatte aksjene opp. Oljeprisen, skal vi se valutakursene på euro og dollar. Kronen styrker seg litt både mot euro og dollar. Opp 0,6% mot euro til 11,68 og til 10,56 mot dollar. Verdien på oljefondet, som snuste på 18.900 milliarder kroner i går, litt ned til $18.775 i dag. Vi kan også ta med at Atlantic Sapphire dagens vinner, med en oppgang på 16,28% nå, har vært oppe 25% til 25 øre på det høyeste, og det kommer etter at selskapet har meddelt hva Strawberry Capital, Condir Management og Nordlaks har tegnet i emisjonen. Golden Energy Offshore stiger på nyheten om at det har sluttet MPSV Energy Dutchess til 1. mars 2025 med opsjon på forlengelse, og at skipet allerede på vei ut i Nordsjøen. Og aksjen den kan vi se, den var faktisk en av de som var mest opp i sted. Nå den ikke på topp 20-lista lenger, men den var opp 8% på det meste. Kongsberg-gruppen også en av aksjene som stiger på den økte spenningen i Midtøsten, og Scana stiger etter at MEG Finance Namibia har meldt at de har hyret inn Deutsche Bank for å fullføre finansieringen av budet på Scana. MEG la jo frem et bud på 4 kroner per aksje for en drøy måned siden, som mange da stilte spørsmål ved. Carnegie har hevet kursmålet på Telenor fra 151 kroner til 162, og den aksjen den nesten uendret, opp 0,07% i øyeblikket. Thor Medical var opp 82% på det meste de 2 siste ukene i går, etter at selskapet forrige uke meldte at pilotfabrikken på Herøya var ferdig, på tid og på budsjett. I dag har aksjen på det meste vært ned 26%, og i øyeblikket så den hentet seg litt inn igjen. Nå den bare ned 9,8%, til 1,38 kroner. På det høyeste i går så var den oppe i 1,74 kroner. Administrerende direktør Jasper Kurth med oss om litt. Og alt dette og mer til kan du lese mer om på finansavisen.no nå. På børsene i Europa så det stort sett ned. Det eneste plassen litt opp i London, opp 0,13%. I Frankfurt det ned 0,6%. I Paris det tilnærmet uendret, ned 0,09%. I Milano det ned 0,5%, det samme i Madrid. Og Stoxx 600 ned 0,17% i øyeblikket. På børsene i New York så ligger det an til å åpne svakt ned. Dow Jones ligger nå an til å åpne ned 0,2%, det samme for S&P 500. Og Nasdaq ligger an til å åpne ned 0,11% i øyeblikk i hvert fall. Vi kan ta med i kryptomarkedet så Bitcoin ned 1% til $61.103, mens Ethereum opp 0,14% til $2,455. Og vi straks tilbake med dagens gjest Jasper Kurth i Thor Medical. Ja, da har vi med oss administrerende direktør Jasper Kurth i Thor Medical. Welcome.
Thank you very much. Thanks for having me.
Yeah, first of all, Kurth, can you give us a short introduction and update to where Thor Medical is right now?
Yeah, right now we are an emerging supplier in the emerging market of alpha emitters in cancer treatment. So we're talking about radiopharmaceuticals where you basically have a radiation therapy from inside. So you inject a molecule, a drug that is basically on the one hand a isotope, on the other hand there is a protein or peptide structure that finds the tumor and finds the metastasis or single cancer cells in the bloodstream, and then deploys the payload, and that's the isotope that we are producing, an alpha isotope, which is the strongest emission in the nuclear chemistry, and actually destroying both DNA strands and effectively killing the tumors. So that's emerging technology and a new paradigm in oncology, and I'm very proud to be part of it.
Thor Medical was up more than 80% on Oslo Stock Exchange for the last 2 weeks yesterday, for the most, and today the stock has been down at to the most 26% and now only 10% from yesterday's highs. What do you think caused the big swing?
We had some good news coming out of our site in Herøya in southern or 2 hours south of Oslo, where we have completed our pilot plant. And it's not uncommon, as you know very well, Stein Uwe, that good news drive the market price up. And we are very happy to see this momentum picking up, and that people and investors see the potential of this company, and the fundamentals are still very, very positive looking into this market. We believe that there is a opportunity for us in just a few years' time to gross out about $1 billion. So we're talking about 10 years, ramping up production toward that goal, because we believe that this will be a strong pillar in oncology, and with that, of course, creating a multi-billion US dollar market worldwide.
It looks like you had an interesting career with Bayer Pharmaceuticals. Why did you even consider position as CEO at Thor Medical?
Yeah, I spent my entire life in Bayer. It's a wonderful company, and I'm very grateful to the rich stations that I could witness and could see, and how Bayer supported my development. And as a matter of fact, I had a very nice career laid out in front of me. But then I got approached by the board of Thor Medical, and I had a very nice meeting with my predecessor in the CEO seat. And I was convinced that this is something even more meaningful than being part of a big pharma company. I think we can change the way cancer patients are treated, because if Thor Medical is successful, pharma companies can actually use this isotope, which is much stronger than current isotopes in the medical use, and it can mean a disruptive change going from treating to curing cancer in many cases. So this is really energizing me very well, as you can imagine.
Yeah, you've been with the company for 2 months, a little more than 2 months. How has it been to leave a giant pharma company for a small radioactive startup?
That's a great question. So first of all, we wanted to stay around in Scandinavia. We just moved from Stockholm to Oslo. We are a German family, and this is part of our lifestyle right now, being in the outdoors. But from a big company where decision-making sometimes is a bit slow and you have to align, it's very fast-paced in Thor Medical. And the team, I couldn't be more happy with this team. They're very committed. They are smart. We have the brightest mind in the field of radiochemistry on board. And everybody is really thriving toward that goal of making a difference for cancer patients worldwide and actually getting this off the ground. And yeah, for me, the last 2 months have been nothing short of amazing, and I'm very grateful for being a part of this journey and actually being part of the team.
Are you moving to Norway, or are you relocating Thor Medical to Stockholm or to Germany?
No. I think Norway is the place to be. We are living in the suburbs of Oslo, so we moved end of July for me to start work 1st of August was my first day. And my family is settling in well, and we are here for the long run. So it's a great place to live, it's a great place to work, and I appreciate the way Norwegians think in terms of work-life balance and really being very committed and very eager to get things done. So for me, that's really a very rewarding experience.
As you explained, Thor Medical will be a supplier of alpha emitters for cancer treatment from naturally occurring thorium, which is basic radioactive element. Can you tell us a little more about the production process, the products, and why this is worth investing in?
Yeah, absolutely. I'm happy to do so. The main idea is that we don't use traditional methods of producing isotopes. So when you look at the current market, where isotopes in the medical application are rather in the field of beta emitting, which is not as powerful as our alpha emitters, but also the alpha emitting isotopes. They are produced using expensive and big sites like nuclear reactors or cyclotrons. And with that, they consume a lot of energy, water, and they create long-lasting radioactive elements. So it's not a great view from sustainability, from an environmental standpoint. Our technology works with run-of-the-mill chemistry equipment. So we're having a proprietary technology that is very simple when it comes to the elements that are used, but the ingenious part is how this is all arranged. And we are, of course, having filed patents for that. But our process is very efficient. It doesn't consume much energy or water or other resources. In the end, the isotope is produced without using any irradiation and not creating any radioactive waste, which gives us not only a competitive advantage, but also gives us the peace of mind that we are not having an impact on the environment like other producers have. And I believe this is the future of medical isotope production, using materials that are abundant in the Earth crust, like thorium is, which is a byproduct of the mining industry. And then we take this in our process and basically from a rock into the patient to kill cancer. I think this is an amazing story coming out of Norway here.
Anyway, you needed authorization from the Norwegian Radiation and Nuclear Safety Authority for establishing the product plant. Is this production in any way dangerous?
That's a great question, Stein. And we are a small company, but we're not in the business of making shortcuts. So we have one of our key employees has 20 years experience working with DSA, the Norwegian Nuclear Radiation Authorities. And she knows exactly how to handle these things. So we have obtained all the licenses earlier this year for importing, exporting, and handling radioactive waste. So I think from that standpoint, we're covered. And our production uses nuclear material, and for that, inherently, there's a risk. But we are making all the precautions to limit this risk and have mitigating procedures in place to avoid any spillage. But even in case there is spillage, it's not comparable to reactors or in terms of activity in the material. So it can be contained. And from where I stand, speaking to the experts, it's no concern for the environment or the people working there. But we adhere to all the rules imposed by the Norwegian state.
We have a picture here. Is this from the plant, or is just this part of the plant?
This is actually the plant being produced or being constructed. This is an evaporator that we see here, brand new equipment, which got delivered a couple of weeks ago. And now it's actually put to use. So the plant, as I said before, is mechanically complete. And now we are in the commissioning phase. And there will be a small opening procedure and ceremony. But this is an integral part of our fast-track plant. And the purpose of this plant is not to produce commercial volumes to be injected in many patients, but rather to prove that our technology works, that it's scalable, and that our customers can verify that our product is on spec and can be used in their processes. So this is the main purpose of the plant. The industrial scale will come in a later stage, but we take one step at the time while we keep, of course, the ambition inside, but we need to keep our eyes on the ground in front of us.
We have another picture here. Is this the product?
That could be the product. This is a picture we took on site. So I think in this little flask, we have thorium-232, which is our raw material. That's the stuff coming from the ground. And then it's further produced into decay products of the thorium chain. And the patient will be injected with a isotope called lead-212, which is the powerful isotope to kill the cancer.
You explained about the factory. Who will be the customers, and have you signed up any yet?
Customers are typically all pharmaceutical companies that work with radiopharmaceuticals. And we are in contact with many potential customers. Most of the customers, of course, have an interest in verifying our technology and looking at the quality we produce before signing offtake agreements. But we have very mature discussions with many of our customers, and we are remaining confident that the value proposition of Thor Medical and being part of this sustainable and efficient process is of value to our customers in the end, and there will be offtake agreements signed until the end of this year. I'm very confident.
Yeah, you mentioned that you're addressing $1 billion market. What about the competition?
We are not naive to believe that this is a market that will be left to us. Looking at current competitors, we see a lot of hurdles to entry, not only the IP that we, of course, are working on to get it secured, so the intellectual property, the patents, but also the investment necessary. So when you look at traditional ways of producing isotopes, as I said before, you would need to have nuclear reactors, and there is a lot of capex required, and it takes a long time to build a reactor. So I would expect that current producers of isotope will switch from producing isotopes currently used to the more favorable lead-212. And this then, of course, creates a situation where we will have some competition on the market. At the same time, if we make our jobs right and talk about customers now, if they work with us, if they trust our technology and our ability to deliver the right quantities on time, then I think we also will be appreciated from that standpoint, and customers will log in with us, and we can talk about long-term agreements, and we will stay diversified and differentiated enough to get a good share of this $1 billion market.
Where are the competitors? And who are they?
All around the world. There are different companies. For instance, there are Pantera is a company from Belgium that just secured funding for their production site producing actinium-225, which is another isotope that can be used. There is a French company called Oranomed, which is also integrated into a pharmaceutical company, and they also look at thorium-232 as their raw material. At the same time, they will not supply isotopes to the market, but rather produce drugs themselves or with contracting partners. So right now, looking at the landscape which is emerging, I don't see another company with the technology that we are using to supply this market.
Could this be another market for the Chinese to disrupt too, being faster and more cost efficient?
Potentially. The nature of this business is that half-life really matters. And if we talk about lead-212, there's a half-life of 10.6 hours. So you need to have geographic proximity in order to be a relevant supplier. And for the US-American business, which is typically on the East Coast, or the European pharma companies, I have a hard time believing that immediately there will be competitors coming out of China being very close and able to supply these short-lived isotopes to pharmaceutical companies there. So I feel that's something that rather our customers will appreciate, having also a geopolitical situation where they can rely on the ability to supply. And I think this is where companies like Thor Medical would come in.
Is there any Norwegian possible customers?
Potentially, yes. So for me, that's brilliant to see that when you look at Norway and the emerging ecosystem of radiopharmaceuticals building. So if you look at my former employer, Bayer, who purchased Algeta in 2013, 2014, being a pioneer in the field of alpha emissions in cancer treatment. And then we see a couple of other companies developing here, like Onconvent or ArtBio, with a strong footprint in Norway and the greater Oslo areas. We see this powerhouse emerging, and Thor Medical fits right in, and we have geographic proximity to these companies, and potentially we can partner with them. So for me, that's really great also from an economy standpoint, getting independent of oil and gas and finding an innovative way of creating value and tax money for the Norwegian state.
How big a step would it be for Thor Medical to become a drug cancer producer?
Well, that's a big step, and right now we really appreciate the fact that we do not have to invest hundreds of millions of euros into clinical development. So we have rather small investment needs to ramp up our production, and from a risk management standpoint, we are able to supply all different sorts of pharma companies. And knowing from experience that clinical development fails oftentimes, so in oncology, you basically have a 10% chance of a phase 1 candidate to actually get to the market. We don't have to deal with this risk. We are not dependent on all of these companies to succeed. Of course, we want to have them succeed in the marketplace, but for us to stay cash positive, 1 or 2 is enough to pay our bills and to get this company growing.
What's the next milestone for Thor Medical?
Next milestone is to finish the commission side of our pilot site, so the commissioning period, and produce the first customer samples to be sent to our customers before the year end, and to have a verified production process. And then we make the next steps from there. We aim to have an investment decision to build a new site, basically building on the pilot site with commercial volumes, around 12 to 13,000 patient volumes in a year, patient doses in a year. And we believe if the investment decision is there beginning of next year, in early 2026, we can start producing isotopes for commercial volume. And the exciting part, these are isotopes that will end up in patients curing and treating cancer.
What's the probability for making a positive decision early next year?
We talked about the pickup of the share price on the stock market. So I think this is an indicator that there is a lot of belief in this technology, and that radiopharmaceuticals is one of the hottest topics in the pharmaceutical industry is a clear fact. We see every week a new announcement of either investments or M&A activities coming from big pharma in that field. So a lot of people agree that lead-212 is the isotope of choice in the market, and we have bet on this horse. So I think the likelihood is very high, and we are in the market for investors once there is the investment decision that we will need to raise capital around 250 million NOK in order to build that commercial volume site in Hawaii. So I remain very confident that we will attract the investors that understand our story and that can actually see the attractiveness of Thor Medical in the field of producing alpha-emitting isotopes and the future of that business.
It seems that you're starting to run low on cash going into 2025. Will you have enough funds to reach this decision and then?
Yeah, we are a very lean company, so we have a streamlined operations, and we have secured our liquidity, and our runway is big enough to support that investment decision. And if it has to come later, also we are not concerned at all to run out of fumes in the end. So that's not something that I'm concerned about.
When can we expect Thor Medical to be up and running with a solid operating income?
Depending on the investment decision, of course, but if that comes into play and we can build the site, then we can get cash positive shortly after wrapping up production. And of course, what we need is offtake agreements with our customers, but it will not take years and years to get a cash positive position due to the risk and benefit profile that Thor Medical has, being a isotope supplier to pharmaceutical companies.
And when do you think we can expect the company to be positive, have a positive operating income?
As I said, shortly after we have opened up the production site for commercial volumes. So with the investment decision coming in early next year, 26 will be the first year, and then we need to wait a couple of periods to create a cash positive situation.
Scatec Innovation is the largest shareholder with 24.5% of the company. Have you invested any of your savings in the company?
Not yet, no, but I'm waiting for a good moment in time, because my main issue is sometimes when it comes to these things, perception is reality. And if I were to buy shares now and then the price would pick up like it did last week, I would feel very strange, and I think for good reason. I would be challenged by people like you, Stein, if I had known anything about this. So I would like to steer clear on this. Also here, we don't make any shortcuts, and we want to stay on the right side of the law. and that's why we do it when the time is right. So maybe when there is a final investment decision and a capital raise, I'm sure that the management of Thor Medical will be part of this.
Thank you for taking the time to join us again, Jasper.
Thank you. It was a pleasure.
Ja. Ok, hovedindeksen på Oslo Børs den fremdeles opp i overkant av 1% til 1439,58 nå. Brent spotprisen har falt litt tilbake, på $75.33 i øyeblikket. Og vinnerne på Oslo Børs av de mest oppsatte fremdeles oljeaksjer. Og vi kan også ta med Frontline som nevnt, også opp 4%. På børsen i Europa det fremdeles rødt. Ja, det faktisk litt mer grønt nå. I tillegg til i London så det også snudd opp i Paris, og Stoxx 600 helt flat på 520,94. Det var det vi hadde i Økonominyhetene onsdag 2. oktober. Vi er tilbake i morgen med Børsmorgen klokken 8:55. Da har vi med oss i porteføljeforvalter Audun Vikstrand Iversen i DNB Fund Disruptive Opportunities. For oss som det Økonominyhetene klokken 14:30, da har vi med oss eiendomsmegler Terje Tinholt, og det skal dreie seg om oljeprisen selvfølgelig, som kommer før lunsj i morgen. Tusen takk for at du har sett på eller hørt på, og håper du med oss igjen i morgen også.